So at COVID care here in London, we treat patients with COVID-19 who are experiencing homelessness, I guess with a twofold purpose. One is actually decreasing the risk of transmission, so allowing people to safely isolate. But secondly, providing an environment where we can monitor patients on a regular basis to make sure that they don't deteriorate, and if they do get sicker, they're able to be referred into hospital in time. UCLH are leading, MSF are providing medical staff, and there's other organizations such as Thames Reach who are actually managing the housing and accommodation at the center. MSF here is helping staff the project, so we can currently accommodate between 40 and 60 patients if required, and we have about 3 to 4 nurses in the daytime and 2 at night. In addition to that, we are also helping support infection prevention and control and keeping this center running using a lot of the experience we have from the field.
In my previous submissions, I have had experience of epidemic interventions. We go around and do nurses rounds, so we go around checking our patients, making sure they're okay, they're not having any symptoms from COVID, checking observations, which is really important, especially their oxygen levels, because that will really tell us if they are in a good condition or not. That can take us a couple of hours to do that, not because it's work intensive, but because it's all the cleaning between the patients, because of the risk of infection.
When you talk to your teams in the field and people talk about doing this and helping, their community and their families and their country and you accept it, you can see it, but then sort of being in that position where to a certain extent you're doing that, it's just a humbling place to stand, I think, within it all. I mean, with the level of the crisis and stepping in and doing what we're doing, it's very similar to an emergency setup if you're coming in with the first wave. I think the biggest shock or the biggest difference being is that you never really have it in your head that you're going to be doing this in your own back garden and doing this in your home country. It kind of hit a little bit at first, I think.
Starting a new project is never easy, and especially when you repurpose a center to be able to take care of patients with a specific set of needs. This is a unique time in the world when things that none of us imagined would happen in our lifetimes are actually coming to pass. There was a gap, and as MSFers with experience in outbreaks who couldn't currently deploy to other places in missions as well, it was a good thing that we were able to put our experience to use in our home base here.